Good morning. I am Dr. Prashant. Joshi, and today we will be discussing regarding epilepsy. So first of all, the term seizure and epilepsy, they are not synonymous. Seizure is seizure is different and epilepsy is different. The both words, they are not synonymous, but they are loosely used on in the place of one another. A seizure is a paroxysmal event, normal excessive hypersynchronous discharges from an aggregate of central nervous system that are cortical lesions. And a seizure can have for various manifestations. On the other hand, epilepsy describes a condition in which a person has recurrent seizures due to chronic underlying process. A single seizure or recurrent seizures due to correctable or avoidable circumstances does not necessarily mean epilepsy. Epilepsy strictly means a group of disorders of CNS characterized by paroxysmal cerebral dysrhythmia manifesting as brief episodes of loss of disturbance of consciousness with or without characteristic body movements that are called as convulsions. So, convulsion is basically a loss of consciousness or a characteristic different types of body movements, and both of these may not be connected together. Epilepsy always has a focus origin. Now, coming to the causes of epilepsy, the seizures are result of a shift in the normal balance of excitation and inhibition within the CNS. That is abnormal discharges of neurons. That may be caused by pathological process affecting brain. The normal brain is capable of having a seizure under appropriate circumstance, and there are differences between individuals in susceptibility of threshold of seizures. The fever in children undergoing endogenous factors, the variety of conditions that have an extremely high likelihood of resulting in a chronic seizure disorder. They are head trauma, strokes, infections, abnormalities of CNS. So a seizure can have a multiple number of causes. The majority of the causes are generally temporary and are correctable. Now coming to types of epilepsy. The seizures are broadly classified in two types, generalized epilepsies and partial epilepsies. Of generalized epilepsies, first and the foremost common is generalized tonic-clonic seizures. A generalized tonic-clonic seizure is a type of seizures in which the patient is having episodes of movements in all four limbs of the body, along with, and it has four phases: aura phase, a tonic phase, a clonic phase, and a phase of relaxation. The second type is absence seizures, in which a part of the body or a person itself becomes absent for a few times, that is becomes unconscious. Third is myoclonic seizure. Myoclonic seizure means the seizure that presents with sudden jerky movement of a muscle or a group of muscle. It is classified as myoclonic seizures. Fourth is atonic seizures. Atonic seizure means the sudden a part of body, a muscle group, or a joint or body itself loses its tone and it falls. These falls may or may not be associated with loss of consciousness. And fourth is hypserhythmia, that are infantile seizures. They are present mostly in infants at the time of birth or within 1 year, and the child presents with sudden loss of abnormal movements and sudden loss of consciousness. So, generalized tonic-clonic seizures, absence seizures, myoclonic seizures, atonic seizures, infantile seizures, they all are part of generalized epilepsies. Another part is partial seizures. Partial seizure may be a simplex partial seizure. Simplex partial means a part of brain gets activated abnormally and it activates a part of body. A small part of body that produces seizure is called as partial seizure. Simple because now before going to simple, we will discuss what is complex. The complex means a partial seizure that is associated with loss of consciousness. So in simpler, as the name suggests, the patient has movements, either sensory or motor or abnormal movements of body part that are not associated with loss of consciousness. If the same partial seizure gets associated with complex, that is loss of consciousness, it is classified as complex seizure. If these simple or complex partial seizures, if they get converted to a generalized tonic-clonic seizures or a part of generalized seizures like myoclonic, absence, or atonic, it is called as secondary generalized seizures. So we have two types of seizures, primary and secondary. In primary, we have generalized seizures and partial seizures. Generalized seizures are generalized tonic-clonic, myoclonic, atonic, absence, and infantile spasms. In partial seizures, we have simplex partial and complex partial. The partial seizure now may become secondarily generalized to produce a generalized seizures. So another types that are not clearly that fit into this criteria are unclassified seizures. They are neonatal seizures and infantile spasms. They don't fit in either a complex partial category or. Now coming to what are partial seizures. Activity is restricted to discrete area of cerebral cortex and hence it is called as partial, which means not the whole cerebral cortex, but a small part of brain is involved as partial. And they are typically associated with structural abnormalities of the brain. As you can see from the presentation slide, a small part of brain is affected by either abscess, small tumor, or an infarct, and abnormal desynchronized currents from that part originate, which cause the seizures to happen. Now, if these seizures they produce presentation on small part of body, they will be called partial. If the wave of electrical current that is generated from that focus stimulates whole cortex and produces generalized seizures, it will be called as secondary generalized. On the other hand, the generalized seizures they involve diffuse regions of the brain simultaneously in bilateral symmetric fashion. This may result from a cellular, metabolic, biochemic, or structural abnormalities that have more widespread distribution. But as a general, it is very rare to have such a large process affecting both cerebral cortexes. What I think more common is a small majority of generalized seizures we see in practice are basically secondary generalized that arise from a small focus. The partial seizures, as we discussed earlier, they arise from discrete regions of the brain. Now you can see from this slide, the consciousness is fully preserved in the simple partial seizure. Consciousness is impaired in complex partial seizures. If it spread to secondary, where part of brain so as to involve diffusely the whole cortex, will be called as secondary generalized. A simple partial seizure can be motor, can be sensory, can be autonomic, or psychic symptoms with or without alteration in the consciousness. There are three additional features. The first is Jacksonian march. It is the abnormal motor movement may begin in a very restricted region and gradually over seconds to minutes to involve the whole part of body, so that small part of body moves and the march proceeds to involve the whole motor part. It may experience a localized paralysis minutes or many hours, called torch paralysis. For example, in partial seizure, suppose a hand gets totally paralyzed as a part of seizures, then it is called a torch paralysis. The hand may not show any abnormal movements. And the seizure may continue for hours to days. I have seen patients who are having movements of limbs, either upper or lower or facial twitchings, that continues for months and weeks. It is called as epilepsy partialis continua. Other form of simple partial seizures include those that cause changes in somatic sensations. Some patients describe odd internal feelings when